Trying to market to hire new clinicians is really not that much different than marketing to attract more new patients. We live in a new economy. This is 2023. We're going into 2024. The reality is people are buying for different reasons. Employees are being hired for different reasons. They're looking for fulfillment more than anything else. So when I'm looking to attract new employees, new staff, hire a new clinician, it's really not about the money. Like, you have to have a fair offer. You have to have compensation that makes the individual feel like they are being rewarded. But it's way more important that you have the right culture fit, that you have the right path for growth and path for success than anything else. So I know I'm dealing with the same shortages that everybody else in the country is right now. I know that the bottleneck for growing my physical therapy clinic is the challenge of hiring the right clinician to fill the role, to join the team. But as I go through this process and I start to look at what is it exactly that I want as the employer, I have to reverse engineer that process so that I can understand what is it exactly that the employee wants. Because without marrying those two desires, without both the employee and the employer coming out of the agreement with a disproportionate win on both sides, it's just not going to happen. You know, I remember back in 2001, 2002, we were starting the physical therapy practice. We were all cash-based. It was a very small group. We'd go out to happy hour and we'd hang out together, and it was really like a family. But I can remember back then I had the misconception that I'm going to pay a salary as the employer and you're going to do what I tell you to do because you're the employee. You're going to follow the employee manual. You're going to follow the policies and procedures that we established because I, the owner of the business, created this to deliver a very specific patient care experience. Now, fast forward 22, 23 years, and I've learned the lesson that it's not about me. I'm not hiring a cog in a wheel. I'm not hiring a widget maker. I'm hiring a professional. I'm hiring a professional to do a job at a professional level. And so I don't have the authority to tell a clinician what to do and how to do it. I can lay out the expectations. I can lay out the culture of the business. I can show them the direction of the company and where we are going. I can show them my vision for what I believe makes us different and unique in the community. But ultimately, I have a platform and I'm trying to find somebody who wants to join the platform to advance their career toward their goals and their purpose. And so if we can come together as two individuals and we can say, this business is going to help us both achieve our goals in excess of what we could do anywhere else, then we're going to have a great relationship. And forever, I've always been of the mindset that if I want the best employees, if I want the best people on the team, I know that they're only going to be with me for a short while. I know that this isn't the last stop on their development. This isn't the last stop in their career because they're going to go on to do bigger and better things. And that's why I can take the advantage of having an amazing person join the team for a couple years, then move on to the next step in their development, because I'm willing to not only encourage that, but foster it. I want them to leave my company better than when they arrived. I want them to have new skills. I want them to have new opportunities. And in that exchange of value, me providing them with those services, I know that I'm going to get the benefit of somebody that I would never, ever be able to have working for me otherwise. Because we are in a profession, especially in a third-party payer model, where our top revenue is going to be capped, but there's very limited supply on the clinicians we can hire. They generally have to live in our area or geography. They have to resonate with the kind of practice that we want to build and deliver. And they have to be willing to work for a rate that we can afford to pay. So as those circles get smaller and smaller, the candidate pool gets smaller and smaller. I have to be able to think outside the box to offer them something that nobody else is willing to offer. The hospital, the skilled nursing, the home health companies, they can't deliver on the expectation that, hey, come work for me. Give me your best. I will provide you with the resources and the platform to launch you into the next level of your career when you're done working here.